Quick note: this is an automated educational summary of public medical sources, Mayo Clinic, the NIH, and MedlinePlus. It is for tracking your health markers, not medical advice. Always confirm results with a licensed clinician. Millions of people have digestive symptoms every day and never connect the dots. They assume it's stress, food sensitivity, or just how their body works. But here's what Mayo Clinic and the NIH actually say about celiac disease symptoms. When to consider a gluten test. This video walks through the real warning signs, the ones you shouldn't ignore, and when it's time to talk to your doctor about testing. Stick around. According to MedlinePlus and the NIH, celiac disease is an autoimmune condition where eating gluten, a protein found in wheat, barley, and rye, triggers an immune response that damages the small intestine. Over time, this damage can block nutrient absorption, leading to a cascade of symptoms that go way beyond your gut. It's not a food allergy or simple sensitivity. It's a systemic condition that needs diagnosis and lifelong management. Let's start with the digestive signs. Mayo Clinic lists bloating, gas, diarrhea, and constipation as the most common red flags. Chronic abdominal pain and cramping, especially after eating bread or pasta, are huge indicators. Some people also report nausea or a feeling of fullness very quickly when eating. The Cleveland Clinic notes these symptoms often come and go. They're not always constant, which is why people sometimes miss the connection to celiac disease for years. Here's where it gets tricky. Celiac disease doesn't stay in your stomach. The NIH and Mayo Clinic document a whole list of non-GI symptoms. Extreme fatigue even after sleep, anemia and iron deficiency, joint and muscle pain, headaches, and unexplained weight loss. Some people develop dermatitis herpetiformis, an intensely itchy skin rash. Others experience brain fog or depression. These seem unrelated to food, so most people never connect them to gluten. That's exactly why diagnosis takes so long for many people. If you're experiencing a cluster of these symptoms, especially if they've persisted for months despite dietary changes, testing is worth discussing with your doctor. MedlinePlus emphasizes this. If you have a family history of celiac disease, your risk is significantly higher. You should also consider testing if you have other autoimmune conditions like type 1 diabetes or thyroid disease. And if you have unexplained anemia or osteoporosis, celiac should be on your radar. The Cleveland Clinic and Mayo explain that celiac testing typically starts with a blood test for specific antibodies, primarily tissue transglutaminase, or TTG-IgA. If that comes back positive, your doctor will usually recommend an endoscopy with a biopsy to confirm the diagnosis by examining the small intestine directly. These tests need to happen while you're still eating gluten regularly. That's critical. Going gluten-free before testing can give false negatives and waste months. Here's something crucial that the NIH emphasizes. If you suspect celiac disease, don't start a gluten-free diet before testing. It sounds counterintuitive, but gluten in your system is what the tests are looking for. Removing it prematurely will make diagnosis nearly impossible and delay getting answers. Talk to your doctor first, explain your symptoms, and follow their guidance on timing. Patience here pays off with a clear diagnosis. If your test confirms celiac disease, your doctor will explain what management looks like, which is primarily a gluten-free diet, but also often involves follow-up care, nutritional support to repair years of malabsorption, and regular monitoring. If tests are negative but your symptoms persist, your doctor might explore other causes: irritable bowel syndrome, non-celiac gluten sensitivity, or something else entirely. Either way, you have concrete information to move forward. If this resonated with you, if you have symptoms that fit what we've covered, the next step isn't to self-diagnose or start eliminating foods on your own. It's to schedule a conversation with your doctor, bring up celiac disease specifically, and ask about testing. Click the link in the description for a resource guide from Mayo Clinic and MedlinePlus that you can print and bring to that appointment. What type of health tests are you interested in? Comment below and we will make a video about it.